So I'm gonna record this part. So tell me what your experience is like on this telehealth session. I know that you initially said that you were kind of concerned about using technology.
Because I don't know how.
You do know
Once
how.
we
Look,
get
you're on
connected,
this
it was
call.
okay.
How easy was it? How easy was it?
It was fine as long as you follow the prompts.
So
Read them all.
yeah, yeah, you got to read a little bit, right? Relatively easy. Tell me a little bit about what was going on that was bothering you that brought you on this call with me.
Well, traditionally, shoulder and neck and inside shoulder blade tightness on muscles
What,
and flexibility, I guess. Yeah.
what were you having trouble doing? Did you have trouble doing anything, or
Well, sleeping is very uncomfortable, and I tend to sleep on my stomach. So having your hands up by your head, bringing them up over my head or under the pillow
uh-huh.
has
Oh,
always been the way I slept, but now I can't. It
you
gets
can't do
harder.
that.
So
Yeah.
I'm having to try and learn how to sleep on a side or to take pressure off of those shoulders. But when you're asleep, you tend to go into your comfort thing. So when I wake up, they're very, very sore.
Yeah. So you wake up, you wake up sore and stiff because you went into that
Yeah.
position?
Sometimes even dead. Like I'll have a dead arm quite often. I'll
Oh,
wake up with a dead arm and quite sore, the hand and everything,
yeah.
So have to
That's not,
sort of.
yeah. That's not good because that's like pinching on a nerve when you're so I'll talk to you about it next time when it comes to like what kind of pillows you're sleeping on, because that makes a big difference. We started selling pillows here where you get measured based on your size and the position that you sleep.
Mm-hmm.
But I can talk to you more a little bit about that, and you can always, take one and try it, and then you decide. You let me know, if it's helping you with that. So
You
how?
always wonder if that's the problem. Your chest holds your head up off a certain level. So you sleep without a pillow, you're on an angle, you sleep it. I always
Yeah.
wonder if that.
Yeah, there's different positions, but we can go into that a little bit more next time. The key thing is we want to get rid of the stiffness because it's tricky because you look like you have some flexibility, but you're feeling really tight. And what's happening is you've got a lot of neck issues that's kind of going into your shoulder. How easy was this session to kind of find the problems that you're having? How easy was
Well,
it
I
to
mean,
find
it's, in layman terms, whatever, but it helps when I'm able to describe all the different kinds of things and then to get the almost reassurance that it's not that you understand it. Do you know what I mean? It's like
yeah,
sometimes you feel something, it's like if I'm turning to the left, why does it hurt down on the right? You know what I
yeah,
mean? But you have to tell, full disclosure, say what's going on. And then
yeah,
to see that that's not uncommon helps an awful lot.
yeah. And we're
Because
finding
sometimes you
out.
think you're a little crazy, if you turn into over this way and something hurts down the other side, you're like, what's going on?
Yeah.
But
Well, are you okay with me finding out that there's actually a few other problems besides just neck and shoulder? Because you've got some
well, in
lower,
all
got
honesty,
some
I'm
back
quite aware that
issues.
there's an awful lot of problems going on over here at Camp Me, but and
We
sure,
can fix that. We
identify
can
as
fix
many
that.
as you want. As many
We can
as you
fix that.
want.
It's all related. It's it's all related. Like a lot of times when you have we find this often in our neck and shoulder people when they can move, that there is a back and hip component. And when we find those problems and give you the right movements to do, it's easy to fix. So
Mm-hmm.
so I gave you this one, just like literally one thing with the instructions to do. We'll send you the video to give you the support between the sessions. And I'll see you next week since you know exactly what to do, right?
Awesome. Thank you so much.
All right. Thank you.
Bye-bye.